Today I'm breaking down the toughest questions you're going to face in your PA school interview and exactly how to answer them so that way you stand out and remain memorable. Let's turn those nerves into confidence so that way you crush the PA school interview. Picture this. You're in the hot seat and the interviewer drops a question you didn't expect. Your heart starts racing. Your mind goes blank. What do you do? Today I'm going to give you proven frameworks and real examples to handle any question. So the first type of difficult question is an ethical dilemma. An example would be, what would you do if you saw your supervising physician make a medical error? Why did they ask this? They want to see if you have integrity, professionalism, and the courage to speak up, even when it's uncomfortable. So how do you answer this type of question? You want to use the STAR method, which is an acronym for situation, task, action, and result. So the situation, you briefly set the scene. The task, what was your responsibility? The action, what did you do? And the result, what ended up happening? So as an example answer, during my hospital volunteering, I once noticed a nurse almost administered the wrong medication to a patient. I politely interrupted, double-checked the chart, and we caught the error together before it reached the patient. I learned the importance of clear communication and respectfully speaking up, even with more experienced team members. As a PA, patient safety always comes first, and I'd approach a supervising physician with the same professionalism and respect. Do you see how this answers a question directly? So if you're given an ethical dilemma, such as the example here, use this framework and you'll be able to answer any question. The second toughest question, and one that I use during my practice mock interviews, is academic integrity. And the question is, what would you do if you saw your classmate cheating on an exam? Why do they ask this? They want to know if you value honesty and handle tough peer situations. So how do you answer this? So first, you want to show empathy, but you want to prioritize integrity. Second, you want to mention following the school's protocol. So as an example answer, academic honesty is critical in healthcare. If I saw a classmate cheating, the first thing I'd make sure I understand the situation. If I was certain, I'd follow the school's policy and report it to the appropriate faculty member. It is not easy, but as a future PA, our actions impact a patient's trust and safety. So basically, they want to make sure that there is zero tolerance for cheating in PA school and that you are going to report this and uphold integrity. The third most difficult type of question you'll encounter in an interview is handling difficult patients. And the question could be, how would you respond if a patient refuses care? Why did they ask this? They want to see your communication skills and empathy, which is a huge part of being a PA. So how do you answer this? First, you want to show you respect patient autonomy. And second, you want to emphasize clear and compassionate communication. As an example answer, I listen to the patient's concerns without judgment, provide clear information about the risks and benefits, and ensure that they feel heard. If they still refuse care, I document the conversation and inform my supervising physician, respecting the patient's autonomy throughout. Answering this way shows effective communication skills and empathy. The fourth type of difficult questions you may be asked during your PA school interview is role understanding. So the question could be, why do you want to be a PA and not a doctor or a nurse? Why did they ask this? They're testing your knowledge if you know the role of a PA and your motivations. So how do you answer this question? First, you want to be very specific about the PA profession and its role. Second, you want to mention teamwork, flexibility, and patient care. So as an example answer, I'm drawn to the PA role because it allows me to provide high quality care as a part of a team, building long-term patient relationships and adapt to different specialties. I value the balance of autonomy and collaboration, which is unique to the PA profession. Now, one pitfall to this question is saying, oh, well, PAs have lateral mobility, or oh, I like that I can switch any specialty at any given time. Do not mention this in your PA school interview, even if it's true. Saying these types of things is like humble bragging, and it doesn't look very good in your PA school interview. And the fifth tough question you may be asked during your PA school interview is a personal reflection. So something along the lines of, tell me about a time that you failed. Why did they ask this? They want to see resilience and self-awareness. So how do you answer this type of question? You want to pick a real non-catastrophic example, and you want to focus on what you learned and how you improved. So as an example, I once struggled with time management during a busy semester and I missed a deadline. I owned up to it. I spoke with my professors and developed a new planning system. Since then, I've consistently met deadlines and balanced my responsibilities more effectively. This type of question can also be, tell me your weakness. And so, tell me about a time you failed and tell me your weakness. Very similar, and you can answer very similarly because it's going to explain to them the exact same thing. Remember, PA schools aren't about being perfect. They're about showing that you're ethical, reflective, and ready to learn. Practice these frameworks and stay authentic, and you'll definitely stand out above the crowd. If you personally want a mock interview with me, there's a link below for you to schedule a time that works best for you. And if you guys have any questions, leave them in the comments below, and I'll do my best to answer them for you.